Are we back? We've got 3 more teeth to discuss, and that is the morphology of the mandibular molars. All right, so universal view, universal or continuous numbering system. You have the Palmer and the FDI that are going to be on your tooth drawings. As you're learning teeth, it's you take the certain teeth and you just memorize them. 8 and 9 are the central incisors, 24 and 25. You start with 1, 16, 17, 32 are your third molars, 6, 11, 22, 27 are your canines. And then you can start filling in around there to, so you don't always have to start with 1 and go around. So these will be second nature to you before too long. Let's take a look at the general features of mandibular molars. Permanent mandibular molars erupt between 6 months and 1 year before the corresponding permanent maxillary molars. So that is one of those general characteristics, isn't it? The mandibular molars generally erupt before the maxillary molars. The crown of a mandibular molar has 4 or 5 major cusps, of which there are always 2 lingual cusps about the same width. So remember, on the maxillary molar, when you have 5 cusps, that cusp of Carabelli is on the lingual, okay? On the mandibular molars, you always have just 2 lingual cusps. All mandibular molars are wider mesiodistally than buccolingually, similar to the anterior teeth. That's opposite of what the maxillary molars are. From the occlusal view, the outline of the crown is rectangular or pentagon in shape. So the rectangular would be a second molar, a mandibular second molar, because it's got 4 cusps when we get into that are somewhat equally divided. And the mandibular first permanent molar, okay, has 3 buccal cusps. Got it? This is that distal cusp. And it is pentagon in shape, 5 sides. Versus a mandibular second molar is more rhomboid in shape. It's got 4 cusps. Which is going to be higher, the mesial portion of the tooth or the distal portion of the tooth?
Mesial.
The mesial portion of the tooth is higher. Exactly. So the mesial portion of the tooth is a little bit higher than the distal portion of the tooth. The mesial buccal cusp is going to be larger than the distal buccal cusp. And it's 4 cusps. First molars, 5 cusps. So if you have 5 cusps, how many developmental lobes does it form from? 5. Second molars, what you know about first versus second class type is that you have roots that are closer together. The mesial root is going to be just a little bit longer than the distal portion of the root. The mesial is going to be wider. So this is the distal here. This is the distal. How do I know that's the distal? Just a little bit shorter than the mesial. I know this is the mesial here, mesial buccal root. because it's the largest. So just putting what your characteristics are together, you'll be able to figure this out. Now, this is the lingual, and this is the buccal groove, separating the two. What do you think is going to be more caries prone?
The buccal groove.
The buccal groove. All right, so this is opposite of what the maxillary molars are. For the maxillary molars, the lingual is more caries prone. For the mandibular molars, the buccal is more caries prone. All right, and you're going to be marking down on all of your drawings the eruption dates, the root completion dates, and the numbering system, because you do need to know what the eruption pattern is. For your second molars, okay, we're going to do the second molars because it's because it's more symmetrical, and then we'll get into the first molars. So you've got two buccal cusps and a single buccal groove. Second molar, single buccal groove, okay? The buccal cusps are almost equal the mesial distal measurements. The roots are shorter and closer together when compared to the first molar and more distally inclined. Again, when we're comparing them to the first molar, because the first molar is going to have two buccal cusps as well. Or lingual cusps, I'm sorry, this is the lingual. 1, 2. And then this is 1, 2, 3 for the first molar. So take a look at the root spread. And take a look at the occlusal pattern too, to show you that this is a first molar compared to a second molar. This is that fifth cusp. Mandibular molars are usually bifurcated. That means they have two cusps, having two roots, a mesial and a distal root. So it's very easy to get your instrument for a furcation to try and check for furcation involvement on a mandibular molar, unlike a maxillary molar that's three-rooted. From the buccal view, first molar versus second molar, okay? Buccal view, 1, 2, 3. Can you see the difference? The buccal view, how many grooves does a mandibular first molar have compared to a second molar?
2.
There you go. So you're putting the pieces of the puzzle together. The crown is a little lingually inclined. Okay, again, we're talking about how the tooth feet meet together. The maxillary and mandibular molar widths make up 51% of the mandibular and 44% of the maxillary quadrant. So the mandibular molars are a little bit larger than the maxillary molars. Third molars, the wisdom teeth, are the only teeth with no tooth proximal contact on the distal surface. Why is that? Third molars are the only teeth with no tooth in proximal contact with the distal surface.
Because they're the last ones.
It's the last one. There's nothing distal to that. That's right. There you go. But this is making it sound harder than it is, okay, just with the language. What are the functions of molars? For grinding, maintenance of vertical dimension, maintenance of arch continuity and proper alignment, and to support the cheeks or aesthetics. So aside from the incising and holding, right, the rest of the functions are there. What do we know about all mandibular molars? The mesial distal dimension is greater than the occlusal surface, occlusal cervical, the mesial distal dimension versus the occlusal cervical, because they're shorter teeth. They're wider but shorter. They're larger than the other teeth, but the shortest occlusal lingually or occlusal cervically. Crowns taper narrower from the buccal to the lingual, except the maxillary first molar that has that large distal lingual cusp. So the maxillary first molar is one of those teeth that does not taper narrower to the lingual. What is the other tooth that we've talked about? Do you remember? That might not taper narrower towards the lingual.
Is it the second premolar?
The mandibular second premolar that has 3 cusps, because it's got 2 lingual cusps. Very good. From the occlusal view, the molar crowns taper narrower buccal lingual from the mesial to the distal. They taper shorter. The mesial is a little bit higher than the distal. The facial contour is in the cervical third, as it is in all teeth. The facial contour, okay, height of contour, is in the cervical third, as it is in all teeth, the fattest part. The lingual height of contour is in the middle third, as it is in all posterior teeth. Where is the lingual height of contour on anterior teeth?
Cervical third.
The cervical third, exactly, because that's where the cingulum is. The mesial contact is located near the junction of the mesial and occlusal third, so it's higher than it is on the distal. How can we tell a top from a bottom?
Root numbers.
Root numbers is the first one, yeah. Root numbers and looking for those other characteristics. The mandibular mesial distal is greater facial lingually versus the maxillary. I'm not going to be talking about this on your test. The maxillary molar is more square, while the mandibular is more rectangular, okay? Mandibular molars have 4 large cusps, especially the second molar. The maxillary has 3 larger cusps, plus that smaller distal lingual cusp. You want to look for that cusp of Carabelli, and each cusp is formed from 1 lobe. So we know that this is a maxillary molar. We can see the cusp of Carabelli, and guess what? There's an oblique ridge, and this is that distal lingual cusp. Mandibular crowns tilt lingually relative to the root axis. So remember how that mandibular premolar had that distal lingual tilt? Mandibular molars have that just a little bit as well, versus the maxillary premolars and molars are more straight up and down.
Misty, just have a quick question. So the oblique ridge is not the same as the marginal ridge, is that correct?
Correct. The marginal ridge is going to be here. This is the mesial marginal ridge.
All right.
This is the distal marginal ridge.
So the oblique ridge usually within the occlusal surface, not on the
Yes.
side.
On the this is the occlusal table right here. This is all the occlusal table. And what these dots are showing is the height of the ridge. So you've got a ridge here, you've got a ridge here, and then these are your cusp ridges that come together. So the mandibular molars have that slight distal lingual tilt. For maxillary molars, you're looking for 3 roots. You're looking for trifurcation. The lingual root, the palatal root, is going to be the longest and the largest. Out of the 3, that distobuccal is going to be the shortest and the smallest. Out of the buccal, the mesiobuccal is going to be a little bit longer and larger than the distobuccal. The mandibular has 2 roots. What I don't like about this picture is look how short this root trunk is. And that is not really indicative of a mandibular molar. That root trunk should be a little bit larger. When you have 2 roots, the mesial is going to be larger and longer than the distal. The mesial is going to be larger and longer than the distal. Let's take a look. Where can you tell the mesial, the first molar from the second molar? What's the most obvious here? Okay, for me, it's these 2 buccal grooves. Two buccal grooves. That's the first thing I would look for. Okay, because the occlusal pattern on a first molar is very different than the occlusal pattern on a second molar. The roots are closer together on a second than they are on the first. I don't like where they've placed these root trunks and the bifurcation. Artist interpretation. From the buccal view. The biggest thing. Number of cusps. Are we good?
Miss D, I have a question. So for the root trunk, is it larger on the buccal than the lingual? Because that's kind of how it's showing on the book.
Yeah, it is a little bit, but look at where this root trunk goes. I mean, it's very short, and on the second molar, it's very short as well, and that's not the way it is. The one on the first molar is quite different than the second molar. So I'll show you what the root trunks look like in just a minute. The occlusal aspect for second molars is more rectangular because you have 4 cusps instead of 5. All 4 cusps are about equal in size. You have a transverse ridge in a cross pattern for your 4 cusps. Second molars compared to first might have more secondary grooves. Am I going in the wrong direction? Yeah. And you have 3 pits, the mesial pit, the distal pit, and the central pit. So the central pit's going to be here, and then you're going to have a mesial and a distal pit, the end of the grooves. First versus second. Mandibular molars are normally wider mesiodistally than they are occlusal cervically because they're getting shorter. The crowns are getting shorter the more posterior you go. The first molars you're going to be looking for 5 cusps, 3 buccal and 2 lingual. With 2 buccal grooves on the first molar compared to the second. Second molars are only going to have 4 cusps, 2 buccal and 2 lingual. All molars have proximal contacts, more occlusal on the mesial than on the distal. Okay, that's because the teeth are coming down this way and it's wider on the mesial than it is on the distal. That is that general characteristic. CEJ is relatively flat. Rarely dips into the bifurcation, that's CEJ. But there is something called an enamel projection that we've seen before. This is an enamel projection. The patient did nothing wrong. This is just how the teeth were formed. And what's the problem of having an enamel projection? Is there a problem? Part of the issue is that, remember those ligaments, the periodontal ligaments, don't adhere to enamel. So you've got a PDL right underneath the CEJ, but look at what does not have attachment to it. That tooth was formed, it was destined to have a furcation involvement because that's how the enamel projection made it, because you don't have periodontal ligaments to seal off that area. So you've got a fairly straight CEJ. They're a little bit taller. The occlusal is a little bit taller on the mesial than it is on the distal. From the buccal view, you can see a difference between the patterns, but look at, not only the size of the teeth, but the first molars all have 2 buccal grooves. And the second molars have 1 buccal groove. When comparing first to second, the roots are going to be a little closer together. (10 to 20% of the mandibular first molars only have 4 cusps. They don't have a distal cusp. All right, they don't have that 5th cusp. So if that is the anomaly, they're not going to have 5 cusps. They're not going to have those 3 buccal cusps. So for any test purpose, if you are to identify a tooth, I will have a tooth that is representative of the majority. So a first molar is always going to have 3 buccal cusps. A second molar is always going to have 2 buccal cusps. There is on the lab practicum 1 anomaly, and I'm telling you there's an anomaly. What tooth is it? And name the anomaly. Everything else should be very similar to what we're talking about. Occasionally, look at this. You can have an additional cusp. Oh my gosh, is that a cuspa carabelli? Certainly looks like it. But it's a mandibular molar, probably a 3rd molar, okay? And it's on the buccal. The root trunks are shorter on the first molar than on the second molar, okay? So the root trunk is shorter on the first molar than it is on the second molar. So that means a furcation involvement can occur with bone loss more rapidly on the first molar because you've got a shorter root trunk. These are the teeth that you're going to see more bending in. A sharp bend is called dilaceration. Otherwise, it's called flexion. Occasionally, you'll see mandibular molars with a 3rd root. Isn't that cool? We've had some family members coming in for students in the past that have had this. It's pretty cool. That's an expensive root canal if you need a root canal on that one. from the lingual view. First versus second. The crowns taper narrower from the buccal to the lingual. Usually the mesiolingual and distal lingual cusps are visible since they're longer than the buccal cusps. The mesiolingual cusp is wider than the distal lingual cusp, and the lingual groove can go onto the lingual surface, but it is unlikely to be carious. So if you're going to be drawing a groove in, just make it a little shallow groove, okay? Because the buccal is going to be more caries prone on a mandibular molar than on a maxillary molar. CEJ is relatively straight. The roots are narrower on the lingual than they are on the mesial. A little bit of a twist. That's just trivia. When we're looking at the proximal view here, these are the mesial views. Mesials are usually taller than the distal, so we oftentimes don't see the distal from the mesial view because they're wider and taller. The buccal height of contour is in the cervical third. The lingual height of contour is in the middle third. I've got that reversed. The buccal height of contour is in the cervical third. The lingual height of contour or crest of curvature is in the middle third, as it is in all posterior teeth. There's something called a buccal bulge. It's more prominent on the mesial half. Is this a first or second molar?
Second.
Second.
Second. First.
Okay. This is a second molar because what we're not seeing is we're not seeing that distal cusp. From the distal, you can see more of the occlusal surface from the mesial because, again, the tooth is shorter on the distal than it is on the mesial. So you can kind of peek up to that mesial surface. You can see the cusp tips of the longer mesial than you can on the lingual. CEJ is relatively straight, very slightly curved. And if it curves, it's going to be more curved on the mesial or the distal. Which surface?
Mesial.
Mesial. Okay, so this is the mesial view here, which is taller than the distal view. And these are the mesial cusps that you can see from the distal, because it's just showing you that the mesial is a little bit taller. Distal marginal ridge is more cervical than the mesial marginal ridge, which means it's lower, it's closer to the CEJ because it's shorter. That's all it's doing, is saying it's shorter on the distal. The mesial root is broader and longer than the distal root. So when you're drawing your mesial, we're not going to see any of the distal. But when you're drawing the distal, we're going to be able to see a little bit of the mesial because the mesial is broader than the distal. So the distal is going to be just a little bit narrower. When you're showing it on the mesial, we can't see any of the distal. There are root depressions. Look at where that area-specific curette, all the configurations there that your area-specific needs to go in and around. So these are why we're going through oral anatomy, because if the gum tissue is at the CEJ and they've got a pocket and this is the bone here, you've got to know where these curvatures are to be able to round that toe, to be able to get that calculus in these grooves. First molar versus second molar. Are you pretty comfortable with this? 1, 2, 3, 4, 5 versus pretty obvious now? Okay. Again, the mesial is going to be taller and larger than the distal. So we know that this is the mesial here and this is the distal. Tapers towards the distal. Tapers towards the distal. Mesial. Mesial. Mandibular second molar is triangular in shape versus the first molar is more like a pentagon. Tapers narrower from the buccal to the lingual. The distal is narrower than the mesial. And again, look at these pits. You have to be very specific when you are naming your pit. Mesial pit, central pit, distal pit. Triangular ridges and transverse ridges. You need to draw your transverse ridges and label them. So your first molar, mandibular first molar, has 2 transverse ridges. And then what is this for the 5th cusp? That's just a triangular ridge that doesn't meet anything. Three fossas. The first molar is going to have more distinct anatomy than the second. Mandibular first molar is 5 cusps and it's more zigzaggy with that central groove. So you've got a transverse ridge and another transverse ridge on this side. And then this 5th cusp is just a triangular ridge. Second molar, it's not so zigzaggy, it's more in a cross pattern. Buccal groove with a buccal pit that's more caries prone on the mandibular versus the lingual is more caries prone on the maxillary molars. So occasionally you can have extra cusps. Take a look at these. You have an extra lingual cusp and they are named. They're really tubercles. So the tubercle has 2 names for them. You've got a tuberculum intermedium or a tuberculum sextum if it is on the distal marginal ridge. Intermedium is the middle tuberculum and sextum is the distal tuberculum if you need to label them. The lingual embrasures are generally larger. Size of the cusp, the mesiobuccal is going to be larger on both molars than the mesiolingual, because the mesial is going to be the larger than the distal. And then for the first molar, then you've got, this is the second cusp largest, this is the third cusp, and the fourth cusp, and the fifth cusp in size. So the mesiobuccal is the largest of the buccal cusp, and the mesiolingual is the largest on the lingual cusps. The first molar has the most complex developmental groove pattern of the mandibular molars because it's got 5 cusps. It's a Y-shaped pattern. There's no transverse ridge found on the occlusal. That is different from what another slide was showing that had 2 transverse ridges and a triangular ridge. So the books don't even agree. Occasionally, you can have 3 buccal cusps on a second molar. So this is the first molar and this is the second molar. It's an anomaly. And I'm not going to have us go through this, but take a look at this is labeled everything. Just review this and see if you can name things. What's number 12?
This is the buccal ridge.
It's a buccal groove. Yeah. Okay. Depending on how so the ridge would be this would be the ridge here, the highest portion. Okay. Then you've got 2 transverse ridges. This is the mesial 17 is the mesial marginal, the distal marginal ridge. So you want to separate the tooth and into parts when you are needing to label something. So this is the mesiobuccal. This is the mesiobuccal ridge of the mesiobuccal cusp. This would be the distobuccal ridge of the mesiobuccal cusp. It's going towards the distal. Distal marginal ridge. Okay, first molar, transverse ridge, transverse ridge. Second molar, transverse ridge, transverse ridge. All right, 3 buccal cusps on the first, well, mesiobuccal, distobuccal, and distal, and then there's 4 cusps. So there's 5 on the first molar and 4 on the second molar. The mesial is wider than the distal. Is the mesial taller or shorter than the distal usually?
Taller.
Taller. Exactly. Second molars are going to be more wrinkled than the first molar. The first molar is going to have more distinct occlusal pattern. And with the third molars, it gets more wrinkly with secondary and tertiary anatomy. So third molars are very wrinkly and very in shape. Oftentimes the roots are fused. And this is a good picture of a third molar. Anything goes. So, third molars erupt between 17 and 21 years of age. You're going to add a couple years to that for root completion. They erupt distal to the second molars because they're the last teeth in the mouth, the first molar, second molar, third molar. Do you remember what this piece of tissue is called?
Operculum?
Operculum. And when it's infected, what is it called?
Pericoronitis.
Pericoronitis, exactly. Itis, inflammation of, itis. Usually oval. What is the occlusal pattern of maxillary third molars oftentimes?
Heart shape.
Heart shape, because you don't have that distal lingual. You don't have a distal lingual cusp. Mesial's larger than the distal. The occlusal is very wrinkled. And when you have an occlusal surface that's wrinkled, it is called crenulated. Crenulated. Shallow wrinkles. That's a term I've seen on the boards, crenulated. I have never used it in my vocabulary, ever. Have I used it in a sentence? Third molars usually have two roots. They're smaller, oftentimes fused. If they bend, what direction will they bend in, the mesial or the distal?
Distal.
Distal, they bend towards the distal. Pulp horns, not going to ask you about pulp cavities. Similar to maxillary third molars, the mandibular third molars are going to vary in size, shape, and form. So a typical mandibular third molar, it's really hard to describe. Fuse those roots together and make it a wrinkly occlusal surface. A little bit smaller. The mesial is going to be wider than the distal. Would you be able to tell a mandibular first molar from a second molar to a third molar?
C the first, B the second, and A the third. Is that correct?
Exactly, exactly, because you've got 1, 2, 3 buccal cusps. Okay, notice that this root trunk is just a little bit longer on the second molar than it is on the first molar. These are good pictures. I would, in my picture, I wouldn't necessarily have that one dipping down, but I will take that as well. It's all good, right? The roots are a little bit closer together on the second than they are on the first. So these are pretty decent pictures because it's showing everything that we've talked about. Mandibular third molars often fail to erupt and are impacted. The mandibular molars are more likely, the mandibular third molars are more likely to be impacted than the maxillary third molars. Pericoronitis. Sometimes the patient can't bite because the maxillary molars are biting on this tissue and it's very sore. Infections can be serious. Ludwig angina, you're going to get into this next semester with pathology. I'm not going to ask you about this, but third molar impactions can be serious. Look at how swollen this poor patient is. Pericoronitis, infection. Developmental cysts may form. This is called a dentigerous cyst, and you're going to learn about this. I'm not going to ask you about this, but a dentigerous cyst is a cyst that forms around an impacted tooth, but it's only around the crown. This is what it looks like on a radiograph. It's only around the crown. The cyst doesn't encapsulate the entire tooth, a dentigerous cyst. And that was more than you needed to know. Okay, so we're done. Everything you wanted to learn about molars and then some. Are there any questions? You're going to be drawing a first, second, and third molar. So what we have left to talk about are anomalies, tooth anomalies, and primary dentition and eruption. So next week, we'll be talking about the eruption pattern and the difference with primary teeth versus secondary or permanent teeth. Then we'll talk about anomalies, and you're not going to really see anything new with the anomalies chapter. We're going to review occlusion. We've had that in DNH 141. And then we'll have the Thanksgiving break. We are on the second half of our semester.
Ms. D,
Yes.
ask you a question about the drawings. So when you had, in the sheet that we have, it doesn't say that the pits have